Okay, I'm rolling.
Hi.
Hi.
Just for the record, tell me your name and your title.
Dr. Nikhila Javadi, the Chief Clinical Officer.
So how long have you been here at Covina Hospital?
About a year now.
What was that first year like? I mean, I want to hear the good, the bad, all of it. Just spill the beans.
So when I first was talked into coming here, I heard all the good. So I thought it was going to be very well organized and put together, and I'm just going to walk in. And originally I came in as chief hospitalist, and it was just about managing the hospitalists and doing some clinical work myself. But ever since I've got here, I've kind of been bounced around, not in a bad way, but in so I've had the opportunity to dive in. I've had the opportunity to dive into every department, see how the clinical quality can be improved through every single department. So it's not really just about the bedside nursing or bedside physicians, but how do we improve quality and safety and our EMR and all the things that put the hospital together from a doctor's perspective. So it's been a very fast-paced journey. Every single day is something new. I cannot predict my schedule, even if there is one. And we've had our ups and downs. We've had issues, with accreditation, but we really came together as a team. And now it's almost like a breeze when somebody asks us a question because we all have the same answers. And then we've done some very good things. I think we've changed the culture of being, there's nothing that you can't talk to management about. There is nothing that cannot be brought up in a setting or request an individual meeting or whatever it might be, but the frontline staff has the availability and the ability to bring any concerns, complaints, good things, bad things to their leaders. I think that's one thing I've seen here that I've loved very much is our leadership. I think whether it's the senior leadership team, the team leaders, I think they're very open to their staff. And when I talk to the frontline staff myself, because as I said, I go from department to department and they're very comfortable with talking to me, I see that they respond and they are not afraid to bring things up and they are not afraid to say anything. They really care about their patients here. And no matter what, so anyway, let me.
No, just say it.
No, and so I think I think the physicians have seen also progress, and they understand that it's more than just them now, and it's a whole team that's come together for patient care. So that's been good. Our fight with the MCOs has been very interesting. I think we've made a lot of progress in that department too, because it's more the clinical side and the financial side have come together to make sure that we are getting our patients what they need and getting the hospital the reimbursement they need for taking care of the patients too. So I think that was extremely important achievement this year. And we've had a lot of changes, but I think they've all been positive in some way. Yes, some have been for efficiency. Yes, unfortunately, some people have had to leave the organization, but overall, I think we've made those changes for good and positive reasons. We've made things efficient, and we've evaluated every clinical care policy we have. So everything from when a patient comes into the ER, when they go to a surgery, when they're on the floor, we have really tried to examine how we can do better for our patients. So, and we've figured out or are trying to figure out what the community needs, right? So from the clinic perspective, we're trying to concentrate a lot on preventive medicine. From the ED perspective, we are making sure that substance abuse patients feel that they have been taken care of just like anybody else. When it comes to our psychiatric patients, we've made absolutely sure that there is nursing oversight and they feel like they're supported throughout their entire stay. We are looking to expand our infusion center, dialysis. We've done a community needs assessment so that we can better serve our community. I think, and we've seen that if you hear what the patients actually have to say now, it is very much different. Because, for example, I went with the HVAP surveyor into patients' rooms, and these were just random patients that we didn't choose them. They were just random patients. So we went into the rooms, and they were very satisfied with Loretto. And it's not just happened once, twice. Over the past 6 months, every time a surveyor or a visitor or anybody else has asked a patient, hey, how do you feel? What do you think about Loretto now? They have very positive feedback. And I think that shows that we've changed and our culture has changed for the better. And our patients feel like we are trying to serve them as best as we can. So.
She almost went through the whole gamut.
Yeah,
I
right, yeah,
loved
that's
it.
good, yeah.
I loved it.
Yeah.
See, I love her. I do have a couple. I'm going through my questions like she's targeting every single one. Where do you see us in the future?
So, where I see us in the future, I actually see us here, but I see us expand in terms of what we can offer to our patients. We are not trying to be a tertiary care center. We're not trying to solve every problem on the block, but the problems our community does have, we want them to be solved within the community. And as Loretto is part of the community, they don't need to go elsewhere to get that same quality of care. Yes, maybe they have cancer and maybe they want to go to UChicago or something and get an opinion, but they should be able to come back here and take care of themselves. Let's say that they have, whether it's the community mental health. So our community mental health, I want to be able to make sure that we expand that, and there's better, we take care of the youth, for example. We want to go to a model of wellness and preventive care. So they shouldn't be inside the hospital. And I know our name is the Loretto Hospital, but we're okay being bigger than a hospital. We're okay with them just coming to the clinics, coming to get our care in other settings than the inpatient setting. And so I look forward to being known as a quality care center that this community can come to for about any reason that they have. And if we don't have something, we will refer them appropriately, but we want us to be the first stop. I think that's where we are going.
And if you had an opportunity to share Loretto Hospital, anything about us to the community and a patient, what would you say to them?
I would say we're very different. I know Loretto has been here for about 90 some years, and things have changed over time, and we want them to know that things have really changed. Come visit us, come see us, see how we are, talk to us, ask us questions, even if it's just a visit. We want them to understand that we're here for them, that pretty much any community needs that they have, whether it's in healthcare or not, we would support them. So they come to us for housing, they come to us for social determinants of health issues. We can be a partner in all of that because healthcare is bigger than just a clinical side of things. We want to be involved in every aspect of the community. And so come visit us and see what that's like.
That's all I have.
Yeah, that's good. Yeah.
That's it.
Okay, great.
Hit it and quit it.
Hold on, you got a mic on.